Okay, so we've answered all of the questions that were emailed to us, and thank you guys so much for emailing your questions. And I'm going to unmute the phone lines. If anybody has a question, this would be the time. We have a few minutes left with Gary. So you are all unmuted. So if anybody has a question, this is the time to ask it.
I have a question.
Okay.
Okay, my question is about the amount of testing that's being done. So it was indicated that on Friday, there was a concern about not having enough testing kits. Now over the weekend, that's lifted. Do you think that we're gonna see more testing happen as a result of that? Or do you think that that there's no correlation there with the amount of tests? Because I saw that Tulare County Health posted that they only had 32 tests between yesterday and the day before yesterday that had been processed. And that seems like a really low number.
Yeah, excellent question. Even though there now is a pretty significant increase in the availability of testing kits by being able to use the saline-based, we still are limiting testing to only those people that are symptomatic, that they are exhibiting signs of having the virus. So we still go through that disciplinary process of screening them, applying the CDC criteria, and it's only those patients that meet that we will collect a specimen and do a test. Because you're right, there's not an unlimited amount of the actual testing medium. So laboratories use reagents that are mixed with the specimen sample to create the test for the COVID-19 virus. So there's still a limited amount of that. So they still need to be somewhat selective in when testing is going to be done and when it's not. So, but certainly having more specimen collection kits available increases our ability to do the tests where it is indicated or warranted to do it. So, and again, also, as more and more testing approaches come out, I read just yesterday, although you have to be very careful, there's a lot of fraudulent information out there, but home testing kits now. There's a company, actually a very reputable laboratory, national laboratory, that has announced its ability to do a bedside test that gives you results back within 30 minutes, and that you actually do it at what we call point of care, right at the bedside. So I just worry that everybody wanting to be tested, whether you're showing symptoms or not, just for peace of mind, the risk you're taking is that you're asymptomatic. You don't have the virus, but you convince somebody to test you, and so what peace of mind does it give you? It says right at that moment you're not infected, but again 2 days later you could be infected. So we certainly can't test everybody every single day through the process. So I think for now we're going to continue to just apply the CDC's algorithm that you need to do to get tested.